Hey, welcome back to the Gym Owners Podcast with Anthony
and Natalia.
How's it going? Today we have the president of the Medical Fitness Association, David. David, thank you so much for being on the Gym Owners Podcast. Why don't you tell a lot of the viewers of what the Medical Fitness Association is and a little bit of your background?
Sure. Yeah. Well, thanks first of all for having me on your podcast. The Medical Fitness Association, really our purpose is to advance knowledge, networking, and influence in the medical fitness industry. So we are a nonprofit professional membership organization, and we provide industry standards, educational programs, certification opportunities, benchmark data, professional development, and networking opportunities, really to help improve the operational success and healthcare integration. And so I've been the president and CEO for almost the past 3 years now. I have been involved with MFA for probably close to 25 years. As I was, before this position, I was director of a few different medical fitness centers across the country, and that spanned a little over 20 years of running those facilities. And so I was always, MFA was my number one professional organization, and really I think it really allowed a lot of success in my career due to all the networking, education, knowledge that I was gaining from the association and a lot of the colleagues that I met through there. And so it's great now running the association and, kind of on the other side of the fence, so to speak. All the years of operating facility, now I'm in a position where I can support a lot of these facilities in becoming the best they can.
If somebody wants to get into that field, where would you suggest they start out, they go? If I'm watching this, I'd be like, hey, that sounds like the direction of the fitness industry I want to get into. What would you recommend to, how would I even get started doing that?
Right. Well, if somebody wanted to get involved with MFA, we have a variety of things that you can do. So all of our webinars, we hold probably 2 to 3 a month. They are complimentary. You don't have to be a member to join them. Now, if you want the CECs that go along with them, you do have to be a member, or you have to pay a little extra to get those if you're not a member yet. But a lot of people see the quality. A lot of the gurus, the industry leaders that we have leading those webinars really just have a ton of knowledge and information they share. And that's one of the great things about MFA. It's a group that loves to share information. So you'll get that a lot. Not only is there the webinar series, we have our annual conference that's coming up in a couple of months here in Baltimore, beginning of November. And that's a great way. That was the way that I got involved. So when I was early on in my career, one of the managing directors at the facility I worked at said, I think you should get involved with MFA. I went to the conference, met a ton of people, just kind of put myself out there and introduced myself to everybody I can and could. And that just led to, I ended up going pretty much every year for the rest of my career. And those in-person events, I think not only do you get the education, which is, I think, pretty significant. We have several days of high-level speakers. But it's really then interacting and saying, here's some of the challenges that I have. Have you had this in your facility? And I can't tell you how many times I got suggestions and recommendations that I was able to put in place and just made my facility that much better.
Awesome.
Yeah. And now you're the CEO.
Now I'm running the ship. So. Yeah, I get to help people doing the same thing I've done throughout my career, and that's part of what's really fulfilling is being in a position to be that resource. I get people who are fresh into this field who really need a lot of guidance, and then I get others who've been in the field who just have run into a new challenge that maybe I don't even know the answer to, but I can connect them with some others then.
Gotcha.
Do you have a lot of gyms that, they're open already, but then they want to kind of go towards being a medical fitness facility, and that's why they go to the conference, right? They kind of want to transition into that.
Yes. We and I'll tell you, we've seen more and more of that over the last few years. I would say the commercial facilities starting to recognize the health and wellness side of the fitness industry, and I think really the pandemic helped kickstart that even more. Push it in that direction. So I think we've seen, and we have lots of examples of facilities who have really just made the transition from a pure commercial gym to having not only just a little bit of wellness offerings, but have gone even, we have some examples, have gone to full certification as a medical fitness center. And so one that comes to mind is the Atlantic Club out in New Jersey, huge facility that was, premier commercial gym, still has, those components, but is now a full-fledged certified facility that really has all of the standards of what we put in place to get certified. And so we've seen that in other cases too. I myself, in my career, what I usually was doing was I was coming into a facility that was owned by a hospital, but wasn't operating as a medical fitness center. It was pretty much a commercial facility that was owned by the hospital, but had not really yet taken those next steps. So I was really in charge of leading that integration with the healthcare system, putting in programs and all the pieces that were important for the model.
What are the differences?
Sorry, you go.
Okay. What are the key differences between like your commercial facility and then a medical facility? What are the standards that are put in place? So if someone transition,
yeah, we have 131 standards and guidelines. So I could take you all through that, but that would take all day.
No big deal.
But what I can really distill it down into is, and I say this all the time, there's the commercial component at the core, and that's still there. So a little anecdote on the side that I'll tell you. When I first got to Hancock Wellness Center here in Indiana, it was a hospital-owned facility, but it was running like a commercial facility. And people were really worried that I was taking away all their fun activities. The hospital CEO was getting calls every week about, hey, is my Zumba class going to go away? Is my high intensity training, my kickboxing, all these things, I don't want that to leave. And so we had to hold town hall meetings that told people about what the medical fitness model was. And so it's this core, and you maintain, you walk into a medical fitness center, usually it looks just like your regular commercial gym. You've got treadmills, you've got weight machines, you've got sometimes basketball courts and group exercise studios and pool, things like that. But it's really it's a layer on top of that core. So some of the big things I would say would be medical oversight. Most of the medical fitness centers are going to have a medical director or a committee, a medical advisory committee made up of local physicians, sometimes other healthcare providers like physical therapists and nurses and health coaches and other interested parties who would be on that type of committee. And they serve in an oversight role to provide that information. It was very important, I think, during the pandemic to provide advice and recommendations on what to do. But then also be a liaison that helps promote the facility to the rest of the medical community, who are all sources of referrals, right? So that's one big component, and the centers who are doing it really well have a very active either committee or medical director. But then it goes on to, I would say, the staffing, very professional staffing. You'll have degreed and accredited certified fitness professionals working there, and oftentimes they're going on to get maybe even an additional degree, or definitely a lot of the advanced certifications, specialized in a lot of chronic diseases in that area. So what that allows then is to do all of the chronic disease programming. So whether it be for Parkinson, diabetes, arthritis, all the various chronic disease states that really there's a population out there that they don't feel comfortable just going to any old place. They want to go somewhere that they know, all right, I've got this condition. Maybe I'm just severely overweight, or, but often that comes with a lot of different comorbidities that are, just a person doesn't feel comfortable. So then you bring in some of the expert staff, and you have a specific program for that health concern. And then that population feels like, okay, this is good for me. I can come and feel comfortable in there, and I can get all the great benefits that I need to get, and I'm not going to get hurt and things like that. So I think from you've got the medical oversight, you've got the professional staffing, you've got the programs that are specific to that, and then all of that usually is there's also a level of safety that people feel. These people practice emergency drills because that's going to happen. In my facilities, I don't know if it was every week. It was definitely every month. We had a medical emergency that we had to respond to, and so we prepared for that. That was one of the ways we used our medical director to kind of come up with scenarios and how we respond to those. And whether it be somebody who was just kind of very low blood sugar on that day and was not feeling well, but you want to make sure that you do the right thing for them. But as you start seeing some of these, greater the higher risk populations, you really do need to be concerned with safety. And so that's all part of the equation too. You have to be prepared to and I don't say that to scare people away from this, because a lot of the times it ended up being just a call to the EMS personnel, and they'd come in, they'd evaluate. There's a limit to how much you can do, right? Sure. But I think those are some of the main things. But like I said, our standards have 131 standards guidelines. So it's not an easy path to get to, but not everybody has to get fully certified, right? They can use the model and what makes sense to them, and that's what we've seen a lot of. The Atlantic Club was a special group that was able to put a lot of resources into certification. We have others that are coming to our conferences, coming to our webinars, interacting with folks. A lot of times just getting in contact with those who are in a similar situation to say, all right, here's where we are now, and we want to start the path. And so there's just the steps to get there. I can tell you when I was the director of Hancock Wellness Center, it took years for us to get to really where we felt like we were, and we got certified, but really where we felt like we were a true medical fitness center. But along the way, we were doing a lot of the great things that you can do. And so I think that's another thing. If people are interested in that, just take it a step-by-step approach, and you start opening doors to new populations that will come in your door.
Yeah.
I'm going to be playing the role of somebody that's a gym owner that's watching this that has questions that I'm from hearing you. So I'm saying can you talk about from joining the MFA, and there's different certifications, so you don't have to go all out. There's different levels, like you're saying. There's a couple questions that come to mind. Referrals from doctors now will get sent to your club, if I'm understanding that right, and you're much likely to remain open if there's another pandemic, because now you're deemed kind of almost essential if you have doctors sending their patients over to your club for rehab and such and so forth.
Right. So we did have some good success with some centers applying and saying, we want to stay open, and here's why. And part of the MFA, that alone isn't usually good enough. You have to use examples of what you're doing. And our certification is really a great way to say, here are all the great things that we do. Each state is different. We know that. And so there are some places that are much more restrictive, others that, we were actually surprised by some facilities that in states that we thought it wouldn't quite happen, it would. So I think that is something that puts you in a little better situation if anything were to happen like that again. Hopefully it doesn't, but
Yeah.
I think certainly, putting in some of the safety factors, being part of the healthcare continuum, where, after rehab, this is the next step for a lot of those types of patients. That's, I think, a very important thing. But yes, certainly the referrals from doctors and all healthcare providers, when you're a certified facility, the trust is absolutely there. Those people have to trust that you're going to take care of their patients. Otherwise, it's going to come back on them. They're not going to like that if you don't take care of them well. Yeah. But I think just getting involved, having programs that are specific, and for example, if you have a cancer fit program, you have somebody that went for a specific cancer fit certification, something that's accredited or by one of the top accreditation organizations, then your referrals are going to come into that program. They're going to, a doctor, a healthcare provider that refers, they're going to refer to a program. They really don't tend to refer to individuals. So I think that's one thing that we've seen is you have a program that you can report some great outcomes on. Here are the average results of the people who go through this program. That's
like Rocksteady Boxing for like Parkinson's, for example.
Absolutely. Yeah, they're one of our strategic partners. We ran our Rocksteady in our facilities at Hancock and had great results. We reported on the results, and when you start doing that, it just kind of creates the momentum, and you get repeat referrals. You get a lot of times what you end up getting is people who come in and see that and say, "Oh, well, my mother has Parkinson's. How do I get her in this program?" And then they talk to the mother doctor, and it sort of works that way too.
Sure. If you're a gym owner, can you still let's say like, hey, this is kind of interesting, I'm liking everything so far. Can I still run run it and just sell memberships to normal people? Like, is there any difference that like I'm now limited to how I have to run my facility, or can I still run it with an addition to what comes with the MFA?
Right. Yeah, you can absolutely do that. And most medical fitness centers are selling memberships in a very similar way that a regular gym would do. And a lot of times half the population doesn't really need that level of programs and training and all of this, but they just like coming in because it's a nice facility or it's close to home. And so half of your people probably don't even know that much about what a medical fitness center is. They're just coming and they're doing their normal thing. They have a personal trainer. They go to a class that they love. They know maybe if it is affiliated with a hospital, then they know that, if it's not, but it's still offering some health and wellness programs and is doing some of the medical fitness side, some of the model. They may not be partaking in that. And so, yes, the answer just is yes. You can absolutely do all of the great things that you do for the regular, apparently healthy adult population, and then still do programs that are more specific. Yeah.
Gotcha. Is there once you, like, let's say I'm all in, my gym is great, but I also want to add this other component where doctors are sending me referrals and I want to set up these other programs. I know you have varying certifications, but is there a level of certifications that's required to where if you could, like, once that's done with all the certifications, can you bill insurance companies with that or no?
So, yeah, we're seeing more and more of that. Each insurance is a little bit different, right? So, a lot of times what it takes is going to that insurance provider and saying, here's what we offer, and will you cover that? Some of them will, That's been a slower road to get down. But we've had facilities that are doing a variety of different programs that are getting reimbursed. Again, it's one of those things I think is taking time. One of the great things that is happening, there's a group of industry leaders who are coming together. You may have heard of the Physical Activity Alliance. And so that group is starting to make some inroads onto what they call HL7 for electronic medical records and getting some of the standardization of information coming into those. I think that'll all help lead us further down that path.
That's awesome. Yeah, because if like a doctor sends a referral for somebody that needs rehab for hip surgery and that person needs one-on-one personal, I know they have Silver Sneakers and Active and Fit and all that other stuff, but like if a doctor sends like, hey, go to this place, it's an MFA certified facility center, wellness center, you need physical therapy. And I was just curious if the patient had to come out of pocket or if since the doctor recommended that and it's certified, will the insurance cover it? But I guess you said it depends on the insurance.
Yeah, it's not standardized for everything yet. Somebody gets a physical therapy order, you can almost guarantee that's going to be covered by insurance, right? So they've been down that path, but most physical therapy orders or the insurance that benefits that they have will cover, I don't know, maybe 10 visits, right? And sometimes they have to pay a copay and sometimes they don't. And then when they're done with that, a lot of times the doctor's saying, well, you finished that, but we want you to keep going. Or even the patient themselves may say, I feel like I need a little bit more. And that's where a lot of these facilities have what we kind of call the step down program. So you were in physical therapy, now you're stepped down, but we have a program for that, for you to continue what you were doing. Some facilities are having success getting those reimbursed. I would say most right now are not. And that's where we're trying to get to. And then that's why I think some of the certifications are very important. That's what insurance and even really up to the government and with Medicare, they want to see that these are programs that are very quality programs. And so that's where we've put in these standards. We have the accredited certifications that people can get. And those things are all, I think, very important in elevating the quality of the industry so that it's recognized and able to get that. So I think we're on a very good path there. Are we fully there? Absolutely not. Probably, several years of continuing this path will get us there, I think. And really, as you look at it, the aging of the population, the chronic diseases that are costing the country so much money. I mean, we've probably all seen these statistics, but 20% of the population is costing 80% of healthcare costs. And so that's kind of unmanageable. So that's why I think you're seeing some of the move to this. How do we prevent this stuff from happening? And when it happens, how do we manage it at a less expensive place than in a hospital bed where it by the time it gets there, then people are costing the system tons of money. Could we have programs in that help these people avoid those kind of things? And so we have that. So I think all of those things point to, yes, we are moving down this path to say that, we need to reimburse programs so that it's easier access. We need to have some of these standards in the industry to be able to say, yes, we're qualified to help people in this way.
Mm.
Gotcha.
Yeah, the best medicine is prevention, but you're going to have more likelihood if you're a medical facility, right, to help people with that. So what would you say the process is, though, for a like how many years or could it be 1 year? Does it have to be like several years? How long does it usually take? Well, it's
interesting. Levels.
Yeah. So when I first got to Hancock Wellness Centers here, like I said, it was a commercial fitness center that was owned by a hospital. So the first thing I did was I looked at what standards we had in place already. and we had about just over 50%. So really not that many. There was a lot left to put in place that we needed to do. So from that, it was just attacking the ones that, we went through a whole process. There was, here are some of the easier ones for us to put in place in terms of time and resource and money and all that. And here's some other things that are going to take a little bit longer. And for us, it took about 1.5 years to put everything in place that wasn't, right? And so then we put that all in place. We applied for the certification. We came through and we got certified. What was great then is we built a second facility, and from scratch, we were able to say, here are the things that we're putting in place. And it really, by the time we were open in that facility for about 1 year, we had demonstrated everything that needed to be. So there is a level of, you probably can't just learn about it and then apply in a month or two, because there's a lot of requirements for documentation. There's just a lot of things that you're probably not doing yet. So I would say on average, it's taking people anywhere from 1 year to 2 years to fully put all these things in place. But I really, in that first couple of years, you're already reaping some of the rewards of putting these things, the guidelines into place. I could say that not only is it starting to get new referrals from healthcare providers that's helping your business, but you're just differentiating yourself from everybody else in your market. And so now you're not just Joe's Gym, you're Joe's Gym that has this great wellness offering that people start hearing about. And you can say, yeah, we're doing things a little bit differently now. We have some great fitness professionals that we've hired, and here are some of the great programs. Here are some of the other things that we're putting in place. And so it really just sets you apart. And so you can not be certified yet and really get all the rewards that come with going down that process.
Yeah.
Awesome.
You're raising the bar already a little, I think.
Yeah, we measured our ROI was, I can't remember the number, but the return that we had on what we put into place was so great because we were attracting so many more members into our facility, and they were different members. One of the great things I'll say that I loved as a facility operator was they weren't the population who were usually coming at my busiest times. So I wasn't overcrowding the times that were already crowded. Yeah. I was bringing in a new population that was kind of in the middle of the day when it wasn't so crowded and running these programs there. And so I was filling my facility more hours of the day than normal. And so, it wasn't even impacting those people who come at 5 o'clock and are, trying to get their workout after work. And, now they're upset because they can't get on their machines. That was one of the best parts that was coming. It was a different clientele.
Oh, God.
Is there a certain size that you have to be this? Like, do you have to be at least 6,000 square feet, or can this be for any, like, could it be a boutique gym? Like, what do you see there?
So most of the facilities that go through full certification aren't going to be your very small studios, but we have some that are, they're definitely under 20,000 square feet that aren't, some massive comprehensive facility that has everything under the sun. So yeah, the facility, one of the facilities that I ran early on in my career was about 9,000 square feet. And we did a lot of great things within that. So yeah, I think, size, sure. A lot of times when you're a great big facility, you have the ability to, put in so many different programs that a smaller facility might struggle to be able to do everything. But yeah, I think just, maybe then it means we're going to focus on 2 or 3 conditions that we're going to address, or, things like that. It may not be that you can offer every single thing under the umbrella that you want to, but yeah, I don't think size is going to matter that much.
Mm.
So like gyms have so I'm just using this as an analogy, like some gyms will have different levels of memberships. Do you have different levels to where like an owner's like, hey, this sounds great, but I can't just go all in? Like, what's the process of, can I just start with this, and what does that look like? Or, what's the process if I decided to want to go this route?
Yeah, there are different models. I think that, you do see some that are the tiered memberships, but you also see then the fee for service type of, there's a fee for this program, and similar to, let's say, small group personal training, there's then a fee for this program. And so that's how a lot of facilities offset because there is some extra cost involved if you're staffing it, if you're doing a variety of, if you need new equipment, things like that. Really, a lot of times you don't need new equipment. You're using the same things that you have. So yeah, I think there's a lot of different approaches. One of the things that we did, you brought up Rocksteady Boxing. We did something fairly unique with that, and I think it helped get that population in. They weren't ready. We had 12-month contracts. That population wasn't ready to sign on for 12 months. So what we actually did is we priced our program just a little bit above what our membership was, and they could come on a monthly basis to that program. But then at any point that they wanted to, they could switch over to membership, and then it was an included program. And so they'd actually save money, but they'd have to commit for a little bit longer period of time. So there's a lot of different ways. And in that way, we had people that started out and they just bought the month program. They tried it for a month. They liked it, and they tried it for another month. They continued to like it. And after a few months, they decided, well, geez, I'm going to become a member because I think I'm going to do this for as long as I can. And it also lets me come in at other times if I want to, not just during that program. So there's a lot of different ways to do it. That's one example.
So what's all that's involved? If, like, let's say, I'm watching this and then I go to your website and I'm seeing all the benefits of becoming Joe's Fitness and Wellness Center. What's the first step that I would take?
Yeah, it's tough to say for where each facility is. There's facilities that are, starting from rock bottom and really have a long ways to go. There's others that are doing, have dabbled already and are figuring it out. I'd say, as far as I'm concerned, come to some of the MFA webinars and then consider coming to a full conference, interacting with people, and find out, what makes sense that I can implement today. Is it that I go out and find somebody that has all the certifications that I'm looking for to run this program? Or is it somebody that I have in-house that I want to send through some of this, to get those certifications, get more knowledge about how to run that? Is it a kind of, keep coming back to Rocksteady, and that's certainly not the only program out there, but it's a great example of one. Is it going to find some turnkey type of program like that and put that in place? And that involves some of the education, certification, that stuff. We have a few of our industry partners that offer that type of thing. We have Cooper Wellness Solutions that are part of the Cooper Institute down in Texas. Dr. Cooper's organization. They have something called Cooper Tracks. We have Power Wellness, a management company that manages a lot of wellness centers across the country, and they have their program, MyFitRx. We have Active Wellness. They're putting in their entire Active Wellness Center brand. So there are a lot of different ways that people can find a turnkey type of solution, or talk to somebody that's going to give them everything they need. A lot of times that is coming to the MFA conferences. It's going through. We have a couple, in addition to the facility certification that we've mentioned, we have a director certification. So it's a test ultimately that is certifying individuals that can run facility and some of the programs that are what you would see in a medical fitness center. So a lot of different ways to go about that. I think it's really figuring out where am I right now, and how far do I want to go, how deep do I want to jump into this, and it could be really just finding some individuals who have that level of training that understand some of those disease and health condition populations and can put some programs into place. But like I said, a lot of times there are resources either within our organization or some of our strategic partners that are able to really give you the model of here's how to do it.
Your conference that's coming up, what dates is that?
Yeah, so we're going to be at the Baltimore Convention Center from November 1st to November 4th. And so what we do is we co-locate our conference with Athletic Business, and Athletic Business has a huge expo with tons of equipment vendors and other vendors that can display their stuff there, and they have athletic business sessions. We have our medical fitness sessions. We all kind of go through each reciprocal sessions, so you get the benefit of that. There's even a couple other organizations like NAYS, the National Alliance of Youth Sports, and a few others. So it's a really nice environment where you get this blended learning, a lot of different individuals, but we have a ton of sessions that we offer with a lot of the top industry experts coming to speak. What we did this year, a little bit different, we have another thing that we call the Medical Fitness Leadership Institute. And usually that's an event that we hold separately at a different time of the year. And this year we're putting it as a pre-conference event. So it's on October 31st and then the morning of November 1st. And really, that's designed for kind of the up and coming leaders in an organization who want to learn more about how to operate a medical fitness center, and it's really from a leadership and business standpoint as it relates to medical fitness. So that's a really good opportunity, and we've put it as a pre-conference event this year. So we get a lot of times it's people who are aspiring to be a manager or somebody who's fairly new to a manager. We do get some seasoned management folks that come through that just want to learn a little bit more from some of the experts in the industry, and that's kind of like a day and a half crash course. And then this year it'll spill right over into our annual conference.
So
that's awesome.
All the way to the 4th, if they come for the leadership conference.
Yeah,
okay.
Yeah.
And then at your conference, you're saying there's youth, there's athletics, and there's medical fitness, and they're going to be able to have access to all of that.
That's right. Yeah.
Wow. Okay.
Yeah.
National Association of Youth Sports. So that basically the head person is telling them, hey, this is how you can. So I can tell you the number one moneymaker for personal training was probably sports specific or youth sports, where parents have their kids in sports, and it's almost like a blank check. It's like a blank check. I want my kid to be the best at this sport. Yeah.
Didn't you start that way, David, in sports?
I did. Yeah. I love sports. I'm coaching 2 teams of one of my kids right now. So yeah, I've got a.
What do they play?
I've got a football player, and baseball's kind of go year round. So we just started up baseball, but football we're mid season and just had a game last night. Got a game tomorrow night. So yeah, I'm all over the sports scene with teenagers, and I've been doing that my whole life. Yeah.
I just know how much it was like. A parent I would pretty much just say, yep, your coach teaches the kids all the same, but the kid, better genetics, ends up being the stronger, faster player. We're going to train with your kid one-on-one for that position, that thing. And it was just like, how many sessions do you want me? There you go. There's the check for 6 months of training. Okay.
Yeah. In one of my centers, we brought on a former high-level college basketball player because he wanted to start doing his youth basketball training, and his name alone was bringing in people, but he built that thing up. I think he's still doing it at the center and then some other sites. And so, yeah, I mean, even in a medical fitness center, we recognize that's a big opportunity with youth sports. So yeah, absolutely.
You can incorporate that, and parents, right, would be happy to bring their kids there because they know that you have those, the professionals, people who have high regard in the fitness industry. So they're
Absolutely.
Mind. Yeah, that's really cool. I know it's
Awesome.
no joke having use for my daughter plays club volleyball. So we're always like all over the place traveling. They made it actually, I'm going to brag on her for a second. They made it to nationals and they were they're number 11th in the nation for her team, for her.
Very nice. Very nice.
It's a full-time job. So go you, Dad, because it's like full-time commitment. I'm like, oh my gosh, like this is so much work. But I could see why there's such a market for it in the industry. Parents are like, please, we're investing so much in our kids. We want to see them succeed. So that's
I'll give one little trick, bit of advice to any parents that are looking to coach. Become the assistant coach. Because the head coach, I've been the head coach, and you have a ton more work. The assistant coach, a lot less. So that's a little trick.
It's a good parent tip, yeah. And you don't get all the other parents yelling at you, probably not as much, at least.
I'm just the assistant. What do you want me to do?
I'm just this guy.
Oh Lord. So before we go, can you bring up you said you had webinars coming up. When's your next webinar? And if I'm interested, what should I expect on that webinar that you're going to be teaching?
Yeah, so
or somebody.
All you need to do is go to our website. It's medicalfitness.org. And we have a page that lists all of our events, including our live events and our webinars. I'm looking at it right now. It's our next one is coming up in 2 days on Thursday, August 31st. I'm not sure if we're going to be releasing it before this, but we have several. We have 3 more in September. The one in a couple of days, that's going to be on weight loss success. It's being done with GLP-1 medications and comprehensive lifestyle intervention programs. So you can kind of get a taste just on the title from that. But then we do have one coming up with it's on the legal landscape. So this is kind of focused on nutrition and nutrition coaches and health coaches and understanding scope of practice for that. We have one coming up on marketing, so inexpensive marketing for growth and profitability.
Awesome.
Yeah, another one on aquatic success, so strategies for that. So we really try to span the gamut on different topics, and so yeah, people can come to those. Like I said, it's complimentary even for non-members. If you want the CECs, those are free to members. They're $25 for non-members to get those.
I mean, just those webinars in thing. It's like I don't understand how you would not want to be on those. Like marketing, up to date with drugs for weight loss that's going on. So this way you could be informed of how I should train somebody on this specific drug they're taking to lose weight. So I don't get in trouble because, as Dr. Jess told us, you could easily find yourself in a court case and a waiver doesn't do anything. So yeah, we'll promote those webinars. We'll put the links at the bottom of this video. But I want to say thank you for so much of your time. Tal, you have any other questions for David?
Yeah, no, this was great. I mean, it's going to be, I feel like the Medical Fitness Association, from what I gather, it's wonderful, just all of the resources that you offer, but also too, I mean, it would be, even for someone not going to be a medical fitness facility, you have helpful information for them. Like
That's
any gym owner could benefit from it. So, you don't just cater to that. It's awesome. You could help any gym facility, which is great. I think every gym owner should check it out. So
that's right. Yeah, I do think we try to provide even more information than just medical fitness side of things. So the marketing isn't just for a medical fitness center, right? We are trying to help sure, our members, our medical fitness centers, learn strategies to do things like that better. But it applies to everybody. So yeah, if you're spending an hour a week listening to some of these things and coming up with some one little nugget or maybe several bits of advice that you can put into practice, that's well worth your time, right? And then if you're a member and you're having a few of your facility staff members watch these too, and then they're getting their CECs that they need to stay certified. You're now providing a benefit to your staff. They want to stay with your facility, and we know that turnover's big cost for every facility. So offer another benefit for your staff to say, okay, here's some additional training and education that we're giving you, and oh, by the way, it's going to be free for you to get all these CECs now because we're a member of Medical Fitness Association. You get all of that. So really, when you're looking at the cost of your membership, it might now outweigh the cost if you're trying to help your staff stay certified. That alone could be benefit. But yeah, I mean, we that's what we're all about with Medical Fitness Association. Where it's knowledge, it's networking, and how to improve the industry as a whole.
Yeah. Awesome. I might be joining one of those webinars just so I could see if there's anything new that I myself can learn. Because some people ask me about stuff, which I'm now going to say, I'm just going to point them in your direction. Say,
I'll tell you what, I learned stuff. I learned stuff still after almost 25 years in the industry, and I love it. I'll get on a lot of these webinars myself and listen to some of the people who are just doing phenomenal things out there.
Industry is always changing, so nobody out there knows all. I mean, any true person will always agree, like, we're always learning, and that's a good thing, to always just learn new things as the industry is constantly evolving. So
yeah.
Awesome. Well, David, thank you so much for your time. I do appreciate it. My goal is to get you and Dr. Jess on the same podcast so you can go back and forth on each other. And I think that would be one of the most fun gym owners podcasts we have done.
Yes.
All right, well, it's my honor. Thanks for having me. I really appreciate it. It's always good to talk to a variety of people in the industry. Sounds like you guys are doing some great things too. And I look forward to anything in the future.
Okay, you got it. Thank you, guys.
Thanks so much, David. Have an awesome
day. Also, if you're watching this, post a comment of what you want to see on your next video. And if you have any questions you want us to ask the people on next video. So write it down in the comments.
Yes.
Bye, guys.
Bye. We'll see you. Yeah. Thanks, David.